I'm working on writing a book in trying to explain the new diseases through the ancient lens. And this is an endure. It's not about, treating diseases. It's about a new stream of medicine, like functional medicine. And I hope I would be able to go ahead and introduce to the world a new framework of medicine, which explains all the diseases under a single framework and brings about the glamour and the glory of the ancient time and reclaim back the respect that those sciences would truly deserve. And the last point that I want to mention, that most of the traditional medical doctors call themselves alternative, is self-humiliating. A 5,000 years old tradition with its extremely profound metaphysical, cosmological, ontological, teleological underpinnings calls themselves alternative to a small infant kid, 80 years old, who have usurped the title of mainstream. You got to be kidding me. All right. I will leave it to you. Beautiful talking to you, Mr. Yusuf, and we'll keep in touch.
Likewise, and we'll stay in touch. Good evening. Tonight we are doing a full hour presentation of our masterclass for November 2025. And today we have a guest speaker, Dr. Shabaz Ahmed. He works with Dr. Syed Haider. And the talk is going to be on, non-Western or traditional Western medicine, Ayurvedic, Greek, and Chinese medicine with more holistic approaches to medical systems. So I will turn over the mic to Dr. Shabaz.
All right. So brief background, I'm a naturopathic practitioner trying to revive how the traditional medical systems once saw the healing, saw disease, not how it's actually practiced right now. So there's a huge difference I've seen in how the ancients actually looked at these three great systems of medical practice: Ayurveda, Chinese, and Greek medicine. These were the three main great civilizational medical systems, and I'm trying to revive how they were once practiced as opposed to how it's practiced right now. There's huge gap, and I'm trying to go ahead and raise awareness about that gap, and that's what I do, trying to found and expound on a new system, which I call the TIB. And perhaps if you search my name on internet, you'll probably see what the TIB methodology of treatment is. That basically returning back to the roots of how these great traditions were once practiced. All right. So get to the business. Before I start, I would like to say a few things, a few disclaimers. We just have to understand that we live in a world which are known through the opposites. So, and we know things through contrast. So when I try to show you what I think is right, I would sometimes have to critique what is the opposite of that. So when I'm critiquing something, I am critiquing the concept. And I fully understand there are different worldviews that exist, and that every medical professional is shaped by their own training, their background. So just wanted to give you a disclaimer that my comments if they are directed towards the paradigms, not practitioners. And I believe a lot of people are well-meaning, even in conventional medicine, but they are not aware of what is possible within the scope of natural way of healing. And this is where I came here to bring awareness of what I've seen is possible. And the other disclaimer is that I don't mince my words, and I don't try to sound politically correct, because I don't believe that what is politically correct often aligns with what is actually right. And in fact, constantly suppressing one's true expression, always trying to sound safe and or agreeable to everyone, is one of the main reasons behind many chronic illnesses. And if I had time, I would give a full lecture on this one topic of how the political correctness or the euphemism that is so prevalent in the modern times is leading to a lot of health issues. So I do like to ruffle a few feathers as we go along, but only to keep people awake and engaged. And if I see people sometimes become too comfortable, drowsy, I might say some things that make people sit up straight. And so not to offend you, but to keep the conversation alive. Right. Lastly, that my content is not designed for modern, fast-paced, 30-second Instagram or TikTok sound bites. I deal with serious stuff, and anything serious takes time, attention, reflection to understand. And so I hope I don't bore people, but I'm in the business of exploring deep root causes of the problem and not superficial stuff. So when one begins to examine the root causes of the diseases that plague the modern medical paradigms today, it naturally takes time to analyze, connect dots, diagnose, and suggest treatment. So I ask for your patience. So please bear with me as we go along this together. I'm not entirely sure how much I'll be able to cover, but within an hour and a half. But one thing I can promise you that I think you will learn something new. So anyways, to start with, when I first thought about speaking on Ayurveda or any traditional medical system, it's so vast. I felt like a kid standing at the foothills of Himalayas. And then I thought, where do I start? Then I kept narrowing down the topics, and it continues to feel extremely overwhelming. I won't be able to cover that in 1 hour, 30 minutes. And I finally kept narrowing it down and finally come to this word holistic. And when I looked at the word holistic through a holistic lens, then I still felt overwhelmed. And so at least I don't feel like I'm standing in the foot of the Himalayas, but at least feel like it reminded me of this story. I'm not sure if you guys have read this story about this champion on speed reading. I think the people used to take this speed reading courses seriously in the 80s and 90s. So this guy who took it really seriously, just practiced day and night, and he said he was reading while he's walking, he's reading while he's eating, and and he claimed that he could even read while arguing with his wife in the middle. So on a side note, that's a scary thing to do. I don't want anybody to try that. At least I won't, unless the saucepan comes flying out of nowhere and hit my head. So please don't try at home. Anyways, so after the months of hard work, the guy reached that level of mastery. So the institute that he joined to practice organized an event to felicitate him and demonstrate his skills. So he was given this task of reading Leo Tolstoy's War and Peace, the 1200-pager epic, in 30 minutes, or I don't know, 60 minutes. And he demonstrated it, and he did it. He read the whole thing in an hour, and he was awarded a certificate, and he was giving a press conference. And a quiet guy actually raised his hand all the way in the back, and he was asked, he actually asked, it was quite impressive to see you do that. And he said, but what did you learn about
That's right.
from that book? So he quietly, straight faced, looked at everybody. He said, yeah, I understood that it was about Russia. So I hope you don't leave this talk, and when asked about what you got from it, you say it's about India. And so here's the point. The point is the understanding of this word that I'm trying to give you it was actually shared by all three great traditions. It was not exclusive to any Indian tradition, not as it understood now, but how it was understood by the ancients. So when I finish, at least say India, China, and Greece. That will be perhaps more appropriate answer. All right, so let's move on to looking at the word. So the problem with this word is that it's been so overused, diluted, so casually thrown around that every practitioner of the modern traditional medicine often misunderstand and are very limited in their understanding. And the word has become too elastic. It stretches, bends, and twists to accommodate whatever each person thinks it should mean. So, as I mentioned, things are known through the opposites. And when we try to understand holistic, we need to understand the word reductionist. That's so prevalent. And this is the word that fully characterizes the modern worldview, reductionism. Reductionism is the habit of shrinking a reality that is vast, layered, and profoundly complex into whatever fits our limited instruments, theories, and preconceptions. So what we don't understand, we conveniently think that it does not exist. And instead of being humbled by the mystery, we pretend the reductionist version is the whole, and the rest simply doesn't exist. If someone wants to go ahead and read about Rupert Sheldrake, I really advise you the way he mentions about in his book Science Set Free. Actually, that's a UK version, but there is another book called Science Delusion. He was talking about how the science has become mostly superstition, that science needs to be set free from its own limitations. And he basically described about 10 phenomenon that is repeatedly observed but they cannot be calculated through any devices or any type of instruments that we have. So the science is relegated and limited to the devices that can quantify things. And if we're unable to quantify, then we believe that it doesn't exist. And what doesn't exist are things which are real. And if we do not take the whole thing into consideration, we're still reductionist. So reductionism in our context is human being is reduced to the human body. Human welfare is reduced to providing endless material comfort. Disease is reduced to an abnormal reading on a lab markers. And disease is seen as an enemy to be eradicated at any cost. Often disease is considered as a mistake of the body, only to be corrected by adding or eliminating things. Societal well-being becomes synonymous with economic well-being. Healing is reduced to elimination or elimination of discomforts. So anyways, so what we need before we can heal holistically, and this is important, we could go to the next slide. So it's a vast topic, and all of these things that I'm actually mentioning here, I'm going to practically demonstrate through examples, through practical examples of real patients that I have dealt with firsthand, not some things that I've actually read about or seen in the book, but in clinical medical practice. And you will see something remarkable. I hope it fascinates people. But so before we can talk about healing people holistically, we need a holistic medical philosophy, a philosophy which is coherent, consistent framework of medicine, one that is grounded in principles rather than a free-floating edifice. It is a framework that understands the very purpose of medicine, a single framework that can understand, explain, and diagnose conditions using the same set of underlying principles. And is supposed to remain internally consistent, and all the outward interventions are guided at every step by those governing principles. So this is what is a proper holistic philosophy, and philosophy governed by principles, and you never come out of those principles. Like what? Like the forgotten principle, like do no harm. Yeah, that's perhaps not much possible. At least I would beg people not to do anything absurd or illogical. So what is absurd and illogical, just to give you an example, is to call certain disease as idiopathic in their own admission, and then trying to treat that anyway. And this basically goes against the basic principle of any logic or rationale. That when you don't understand something and you admit, like, slapping the label idiopathic, you better don't mess around with it, because when you try to mess around with something that you don't understand in the name of trying to give symptomatic relief or palliative care, you're going to mess things around and cause more problem than you cause healing. There's something, there are certain things. Another example that I would like to give you is the case of this most simplest of chronic diseases, diabetes. And you can ask any patient, how long did your doctor tell you to take metformin or insulin? The answer comes back for rest of your life. That betrays the fact when somebody is telling you to take something for rest of your life. First of all, that's not medicine. Medicine is supposed to be taken for a period of time until you get well. And we are not getting well. That basically means the doctor, first of all, had no clue whatsoever how to treat it. And he's just masking the symptom. It cannot even be called palliative care, because the palliative care at least provide you relief symptomatically. And most of the time, the diabetic patients don't even see some improvements on their numbers, and they continue to suffer. And there's huge amount of damages that are caused in the name of providing, the trying to control the glucose levels. And I've seen that all the time. Anyways, a group of doctors approached me here where I live, trying to gather support against the vaccines. Like, a lot of people have become these freedom fighters about, how evil is the vaccine, and how, things are becoming so obviously evil, and how all that stuff. So I agreed with it. But I didn't want to support them, because I asked them that question, that when in 1957, metformin came out, and it's the second most common drug being used. All of these guys were sleeping. It took them 60 years to wake up. And the mRNA vaccine, the gene therapy, has woken them up. But the point is that I go to the root causes of the problem. And I mentioned that to them, that they are 60 years late. They should have woken up 60 years when something like metformin interferes with some of your basic metabolic pathways, about how your body breaks down your glycogen reserves, how it basically manipulates your electronic transport chain, how it interferes with your gluconeogenesis. Come on, am I gonna let some external chemical interfere with my basic cellular biology? It's insane to let anyone do that. I would never, ever let anybody come near some of my basic metabolic pathways that has been honed and adapted for 300,000 years of my genetic history. And now I would go ahead and support this guy against vaccine that they've been sleeping around for 60 years, letting humanity get pounded and battered and bruised by these thing called metformin. Just to give an example, I could just go on and on and on how different medications cause that. So this childishness, stays in the modern, and people are trying to become freedom fighters, and talking about vaccine. And I agree with that, but we have to start from somewhere. So I'm in the business of looking at the root causes of the problem. The root cause of the problem is that I cannot just go ahead and rally behind and join their demonstrations against vaccine while the same doctors are taking metformins themselves and they are prescribing that to their patients. Extremely harmful. All right. So I cannot do things half. I completely understand. I'm against vaccines. I'm not promoting anything. But for God's sake, let's not have contradictions here. Right. So this is something that I wanted to mention, that this is medical philosophy, which is not contradictory. When you do stuff, do things consistently, coherently, and understand the principles. You cannot just go ahead and become a freedom fighter and doing something great by opposing vaccine, while you're doing things, when you look at it, it comes from the same category. So this is what I always believe, that I don't do things which contradict each other. I wrote an article on metformin. Anybody wants to go on my website and look at it, called The Sins of Metformin. It's so simple. Anybody just needs to know and use the common sense, the simple common sense that I just mentioned to you. How long should I take this medicine, doctor? Doctor says for the rest of your life. What does it mean? The guy has no clue what diabetes is, and only thing he knows is to just bring down that number on the paper, if at all. And lactic acidosis, body pains, and fatty liver disease, that is what it brings about over the years, for sure. I'm not sure about the numbers on the paper, how much it can consistently bring it down. Anyways, this is what I call a consistent, principled medical philosophy, which does not contradict. Doing one thing at one side and doing the opposite within that same paradigm does not make sense. This is what I call principled. Anyways, the next point is whenever we talk about something holistic, a holistic understanding of the object of study is not just the human body alone, but the human being in its totality. So what constitutes a human being is its physical structure, which is mostly taken into consideration right now, is energetic fields that surrounds him, the pattern of thoughts that animates those energy fields, the attachments of his emotional life and desires which fuel those thoughts, the intellectual worldview that chisels and shapes those desires, the strength of his will, and the clarity or the blurriness of the spiritual vision of his soul. This is what a human being, a holistic view of human being is. So we could just keep sliding up. Yeah, we can go next. Yeah. So what is the next is the holistic view of the world the patient inhabits. So yeah, and the holistic view of the disease. Likewise, we need a holistic understanding of disease, the purpose, the roots of the disease. Disease is not something that has come to harm people. I never believed that the disease has ever come to harm people. It is dis-ease. It has come to cause you some inconvenience, and it is a symbolic expression, and it comes to give you a message. And if you take that message, it'll go away on its own. So something evil has been created out of disease. That disease is something to be quelled, to be destroyed, to be eradicated, and to be looked at as something harmful. This is not how it is understood. Disease, the word itself betrays the fact. It's dis-ease, causing uneasiness because it wants you to look at something that is not aligned with the nature of things. And when you do that, disease will go away. And finally, we need to know the world the patient inhabits. And can go to the next slide. And it has everything to do with how patient contracts illness. The exact example that I gave you earlier, that speaking political correctness all the time, stifling your proper expression, and not speaking out what you think is right openly. I don't want people to be rude. I don't want people to be violent, but we need to speak out. And this is something that has creeped up into the modern psyche, that we always need to go ahead and use euphemism to express ourselves. And that is taking a toll on the human psyche and causing a lot of problem, that is, as I mentioned to you. So this is one of the examples of the ideological currents of the society that shapes the human health and human disease. And we need to understand that. We need to understand the symbolic world that the patient inhabits. And it includes the knowledge of the physical environment, the ideological currents in the social and political environment, the philosophies of the world, the myths and symbols of the time that continue to influence the human consciousness, thereby creating health or disease. This is something what I personally think is what constitutes a holistic understanding. Before we can actually provide people holistic healing, these four different other holistic views are important. So again, where do I stand? Where do we stand with the modern holistic and integrative medical scene here? Without all the stuff that I mentioned, that a physician should understand before he could give integrative, holistic healing, and without which the healing would remain reductionist, right? A reductionist holistic healing is contradiction in terms, because these are two opposite words. So the degree to which we can penetrate the deeper layers of reality, we become holistic, and to the degree we cannot, we remain reductionist. So what passes today as holistic medicine is often nothing more than a gentle version of the same reductionist framework of conventional medicine. So yeah, instead of toxic compounds, let's change it with supplements. Or some people use herbs. The often expression, the herb does the same thing as this drug, and people add a dash of acupuncture, and people have neural retraining now for an extra flavor. And few integrated medical practices started to use the psychotherapist in their panels who can address the mental aspects. So the problem is this: it's not about a bunch of modalities put together to give it a label holistic. Holistic is a philosophy. It's a way of looking at things. It's a completely new paradigm that needs to be consistent across the board. All right, that is so let's go to something more interesting instead of talking too much of theoretical stuff. So what I'm going to do is I'm going to go ahead and demonstrate what I've been talking theoretically, because I believe in results. And if I did not have the results, people will laugh me out of the room. We can talk anything theoretically and expound it and philosophize it, but the proof is in the pudding. And to demonstrate what I was talking about, to demonstrate how a holistic medicine is actually practiced, I would like to demonstrate it through my own patients. Of course, the names have been changed to protect the identity of the patients, but it's quite fascinating to look at some of these stories. And through those stories, I'm going to go ahead and demonstrate point by point all those principles that I was talking about. And these are first-hand clinical insights in my first-hand practice. And some of these patients, their names have been changed. And Dr. Haider is my witness. Some of these people are our common friends, the families of our common friends, and some of our patients that Dr. Haider knows and have shared their stories with him. Anyways, so first patient that I wanted to introduce you to is a distinguished, highly skillful dentist from Florida, Bob. Let's call him Bob. He's a dentist. So when I first met him and analyzed his life, he came to me for a certain problem, and I will disclose that later on. I would like to build some suspense before I go ahead and disclose to you. But let me first go through the list of the patients, introduce them to you, and then I will go ahead and explain to you. So Bob, he was a nervous child, profoundly sensitive, especially to the suffering of other people. He was the kind of child who felt another person's pain almost as if it were happening inside his own body. And he was academically gifted and driven by ambition, endowed with an eye for precision. He excelled in the school. And he became a skillful dentist, right? And I spoke to him. I thought, based on the type of problem that he was presenting with, I thought he has gone through major traumas in life, or any type of emotional upheaval, and any type of child abuse. None of that. He had no major traumas, no emotional upheaval, except some normal academic pressure during the studies and stuff. So he became a dentist, and a skillful one at that. Anyways, he always dealt with amalgam fillings and other chemicals, that is needed in dentistry. And anyways, the problem was his sensitivity to other people's pain. As we know, even the most skillful dentist cannot completely spare patients from discomfort. So for someone like Bob, who was almost constitutionally allergic to the idea of causing pain to another human being, these became a silent source of chronic tension that accompanied him throughout his career, right? So this was Bob. And this is something that we need to understand. The points I'm making here, right? So just pay attention, everybody. Pay attention, because I'm using these examples to make certain points that I'm going to connect the dots later on. So you need to be very careful about why I'm saying that, why am I introducing each patient in certain sequence, and why I'm using certain patients in the last, and the kind of points that I'm trying to make. The point that I try to make here is very important. The first is that we need to understand the disposition. We need to dig deep into like who that person was. And of course, how did he become anxious? Why was he nervous? And was it transgenerational? All that stuff is, but he was a sensitive child and he was a dentist. You need to connect the dots. And he was very tensed when his patients felt pain, and he could not avoid the patient feeling pain. So he went all through his career with a sense of deep stress that he felt during unknowingly, and he was not aware of it, but he was causing himself a lot of damage. Having that disposition and being in the profession of dentistry. Okay. So one thing that I would like to mention, this is the point I'm trying to make, is that we need to understand the human beings in a deeper way to understand how they come up with this disease. So on a side note, we need to understand that some professions are very torturous, and we need to understand some of the people who we see always laughing, like the comedians. Boy, they have a very problematic inner life. Why? Because a stand-up comedian performing before a large audience live in a constant state of emotional exposure. Every joke is a test for him. Every pause is a referendum on their worth. They scan the crowd for approval. And when the laughter doesn't come, it hits their nervous system like a blow. We need to understand. That is the reason why we need to understand the people. And this is why so many comedians, musicians, the public performers, those who are not internally trained, suffer miserably in their inner lives. They try to make outwardly make people laugh, but they live in a constant. Anyways, another side note, I'm not sure if you know about Alexander technique. Alexander was a Frederick Alexander was the name of this man. He developed this Alexander technique. So basically, this technique on a superficial level, they teach you how to improve your posture, and they charge an arm and a leg. Of course, it's in the Western world, it's very popular. They teach you movement patterns. They teach you how to release the muscular tension. And it was Frederick Alexander was a public performer, right? And he actually realized that he was extremely hurting himself while performing publicly. Why? He's causing a lot of muscle tensions and spasms and twitches and all kinds of things that people experience. So the depth of Alexander technique, the whole concept of improving posture and releasing muscular tension, it is just a superficial understanding of Alexander technique. What Alexander people, the Alexander technique people actually teach is being indifference they teach indifference to the audience, and they teach being absorbed in the art, undisturbed by the external expectations. Why? Because not being indifferent to how you are perceived by people is extremely corrosive to the human biology. So that takes us to our next patient, Frank, the musician, right? A tech-savvy artist who made music the central purpose of his life, a vehicle through which he expressed his thoughts, emotion, his inner world. Very, very interesting person, right? Frank lived surrounded by sounds. He was always listening, always improvising, always experimenting, loud music flooding his ears daily. His studio was constantly a landscape of electronic equipment, speakers, mixers, cables, amplifiers, and whatnot. So he's always the headphones, wireless at that, and always bathed in EMF radiations. And again, on top of it, he carried that invisible stress of wanting every listener to approve, to be impressed, to be moved by his work, right? His sensitivity made him a better musician, but it also made him vulnerable. Pay attention to the words that I'm using for each of these guys, and I'm going to connect the dots, and I'm going to explain to you and making all those points that I've actually theoretically mentioned through these examples. Now let's move on to Chris, an art collector from a small town called Odessa in Washington State. This person, a beautiful soul, had an eye for beauty. He collected exquisite artistic pieces from all over the world, fabrics and, you know, souvenirs and whatnot. And he was well known, respected for his skills, deeply appreciated by the people. And his little shop was his pride. It was his craft, his identity, his joy. And suddenly the world changed around him. People shifted towards the corporate chains, giant mall stores, and of course, a small guy could not compete with that mass production. That people lost the taste for exquisite things. Again, pay attention how the world, the capitalist trends, the big malls and these giant chain stores influence human health. Why? Because it took a lot of people who took pride in their craft, their skills, took them out of business, caused them a lot of agony and pain and suffering. They went through a lot of problems. So if we don't understand the culture and its impact on the human health, this ultra capitalism of turning things into giant, corporations, taken millions of people out of the job, made them lose their craft, caused them unending suffering, and they contracted a lot of diseases. This is exactly the point that I was trying to make, that we need to understand the world, and how it changed and how it results in causing. So what happened to Chris? Sleepless nights trying to survive, trying to see how he can compete with these giant corporations, trying to always make his difference felt where people lost the eye. Anyways, let's move on to Alessandra, Italian homemaker, came from a extended family in Italy, lived in a family home here, in the same location, almost like a joint family. Still all of his relatives around her, raised 4 healthy kids, always cooked at home, took pride in her family. Children grew up, they lost their Italian values, suddenly moved away, husband died. Suddenly a woman who was surrounded with her by her family found herself, ended up in an old age home. All right, now let's meet Caroline, the divorcee who still loved her husband. She adored her husband. They both loved each other. 30 years of companionship, partnership, shared life, raised children. But as they aged, something in their relationship soured. They eventually divorced. And a few months later, she discovered that her husband had remarried to a woman much younger and more beautiful. Well, was that woman responsible for her divorce? Yeah, she had doubts. And all the sacrifices she made, all the years of quite, dedicated service to her husband, to her family, suddenly felt that was handed over to someone else. The positive aspect, this point I will come back and make for certain points, but Caroline had a very religious, devoted son who was caring for his mother, and that was the positive thing about her life. But next, let's move on to Lizzie. Now meet Lizzie, the social worker, worked with sincere heart, devoted to the children in her care, ran an orphanage. And one day she suddenly discovered that some of the children in her orphanage had been abused under her very nose, under her trust. Her worldview collapsed. Her belief in humanity, or everything that she believed about how the world operates, it just came tumbling down. All the principles that she believed was a part of her philosophy came crumbled. So she could not emotionally digest that such a thing could happen. So let's stop at these cases, and I would like to interpret these cases and explain to you one common thread. These people, you could see, it's so fascinating. These people came from different nations, cultures, backgrounds, family systems, worldviews, and life experiences. Their stories were completely unrelated. But look at the common thread. The common thread that by the time they approached me, every single one of them were suffering from severe Alzheimer's. And when I looked closely at their lives, I saw same hidden thread woven through all of them. That thread, their minds were deeply troubled by something that they could not overcome. A trauma, a betrayal, a heartbreak, a collapse of identity. Many memories that became unbearable for them to bear the burden of. Another common thread, their bodies were very strong. Their genetics were strong. They were very vital people. physically, but their minds had become a source of continuous torture. Right? So somewhere deep within, they all shared this condition. They wanted to block their memories. They wanted to block the troubling thoughts. They wanted to block that torture. They wanted to block the trouble. So how are they different and how are they common? If you see, this is something fascinating that I'm trying to talk about, is that a proof that human being has many layers of his reality. If you look at Bob, anybody who looked at his case through a microscope and become a biochemist, a physician, his problem was clearly the heavy metals. So you could say, oh, he was exposed to heavy metals and he got heavy metal toxicity because he was always dealing with this, then the other. Yeah, you could say that. So outwardly, the problem with Bob was heavy metal toxicity. So the disease was on the physical plane, the outward disease, meaning the primary assault was physical. But what made his brain vulnerable is his constant torture of being extremely sensitive to the pain of the patient that took a toll, caused wear and tear on his nervous system, that depleted his resilience to be able to detox himself. All right, let's look at Frank. What's the problem with Frank? Frank, the outward reason why Frank had this problem is constant bombardment of an invisible assault called electromagnetic radiations, right? So his bombardment has altered his subtle electrical rhythm of his brain, weakening his defenses. That is the major thing. But yeah, he was diagnosed with all kinds of different things, right? Microbial infestation, parasitic accumulation, whatnot was labeled. But you see, the point I'm trying to make, Bob was heavy metals. Frank, his primary assault, his primary culprit was electromagnetic radiation. Bob was affected physically. His physical plane was assaulted through heavy metals. So his problem came through his physical dimension. But the Bob's problem came through the dysfunction of his energy plane, which was disrupted by the electromagnetic devices. Quite fascinating. If you just go ahead and look at, so the things that I mentioned to you about human being composed of physical plane, energetic plane, mental plane, emotional plane, intellectual plane, and spiritual plane, I'm demonstrating here. I'm demonstrating here how Bob, the disease entered through his physical plane first, primarily, but somebody else opened the door. That's a different concept. But on the second level, Frank, the disease entered through his energetic plane due to EMF radiation. Now, the problem with Chris, the art collector, the souvenir shop owner. His assault was none of these, not physical, not energetic, but mental. He spent years strategizing, worrying about his business, fearing the financial collapse. He ruminated endlessly, night after night, unable to sleep for months, for years. What was it? Mental problem. But yeah, on the physical side, all that lack of sleep has disrupted his glymphatic system that could not clean up his wear and tear, that his cerebrospinal fluid was not being cleared up, causing huge amount of toxicity in his brain, developing all kinds of different things. You could call it amyloid plaque, tau, protein, all those terminology. But at the end of the day, those were only superficial causes, right? The inner life of Chris, nobody knew. Only the doctors who have seen him before me, all kinds of doctors, not just the conventional medical doctors. They saw amyloid plaque, they saw, tau protein, they saw parasites, they saw Lyme, they saw all type of things. But the problem was the inner life that Chris was living for a very long period of time. Now look at Caroline. Her injury came from a completely different axis altogether. She was wounded emotionally. It was her sentimental nature, her capacity for love and hurt that took the hit. Her heart broke. She could no longer tolerate the mind tormenting her emotional world. Her response was to shut down, to protect the heart from further injury. You see, she was affected by her fourth plane, her emotional plane. So if anybody doesn't want to believe that human being is much more, has many, many layers, much beyond physical, and the physical layer is only reflects the assaults caused on the higher planes, I present to you, ladies and gentlemen, real examples of real people. Lastly, consider social worker running an orphanage. Her entire worldview collapsed. Her understanding how the world operates crumbled. What she thought about the world, her relationship with the rest of the creation, and her trust in people, everything collapsed. She could not reconcile what happened to the children under her care and how such a thing could actually happen. And how could the higher power, as she called, let this happen, or what not, right? The problem here, you see, she was hit through her intellectual plane, through her worldview, through her philosophy, came tumbling down. So if toxins gathered, if microbes entered, if the mold took hold, if the parasites assaulted, if the hippocampus shrunk in all of these people, it was not because of these things, because the brain opened the door for these, conspired against its own functioning, and said to these toxins, please come in, shut me down. I do not want to function anymore. This is the problem. This is holistic view of human being. This is the holistic way of disease, looking at the disease. So, as I mentioned to you, Bob, physical plane, Frank, energetic plane, Chris, the mental plane, Caroline, the emotional plane, and Lizzie, the social worker, the intellectual, spiritual plane. Her conflicts were spiritual in nature. She could not reconcile. She could not wrap her head around something. She was deeply religious, and she was assaulted by those questions. Now, if we were to go ahead and destroy their parasites, clean up their amyloids, clean up their heavy metals, well, are we going to heal these people? That's the question. And to demonstrate that, I would like you to introduce to you Mary, an extraordinary case. And I know all of these cases are extraordinary, but she is something so remarkable that she's a singular of all the patients that I've actually seen, that my prediction, my prognosis of her case came true. Anyways, her entire extended family eventually became my patients, right? So they was like my family friends. Over time, they became my family friends. I treated her daughter, her son, her daughter-in-law, grandchildren, all kinds of people. Anyways, whenever I treated them, all of these other patients, they would always bring up Mary's case, and they would always ask me to go ahead and give them some advice on how to reclaim her memory and whatnot. And I knew that Mary had a decades of abuse in her marriage, shocks and traumas and losses and betrayals and all kinds of things that leave a mark on her psyche, right? So, anyways, I still remember one of her relatives when she talked about it, and they wanted to book an appointment. And this is something the physicians have to understand, that you should not treat people where your treatment might cause them more damage. We need to come to terms with it. And I'm going to demonstrate through that case. Anyways, I specifically asked one of his relatives, do not book an appointment for her, because she will live longer if you leave her alone. These were my exact words. But anyways, they continued to talk about her. They took the tips from here, tips from there, and they were close family members. So, and I give some tips for other people's memory enhancement, and how to do this and that. And they took clues from my thing and advices. I never took her as a patient, mind you, but they applied those tips and those suggestions and all that stuff. And lo and behold, her memory improved. She started to remember again, right? So something really tragic happened. And please remember, she's been in that condition for many years. She was eating a much worse diet than she was after they put those implemented those tips in her life. And physically, she was better nourished, but suddenly within 3 months, she developed a uterine cancer. very, very aggressive. And by the time the news of her uterine cancer came to me, it has spread all over the place. Her memory came back, but within 6 months, she died of metastatic cancer. This was a singular case. And this is what I actually predicted. And it came to pass because I knew what would happen if you mess around with the people. So now, ideally speaking, how would I treat her? If I knew that she had the capacity to go through emotional work, she had the capacity to change her worldview of looking at her past in a new light, as her memory starts to come back, then there was a chance of healing her. Otherwise, her body had become weakened, that it had lost the power of shutting the brain down. And when you go ahead and force the brain to start functioning, now the brain is going to destroy the body instead of body trying to shut down the brain. So the point is this. Point is, body is extremely intelligent. Body doesn't want to make mistake. Body is infinite wisdom put together. And this concept of thinking that body made a mistake, I'm going to go ahead and dump few chemicals here, manipulate certain pathways, and I'm going to fix the body. It's absurdity. This is something what I mentioned. This is illogical. So at this point, please, Ms. Steph, I would like you to put on the screen the metabolic pathway diagram that I sent to you earlier, please. Yeah, is there a way to expand it? Anyways, this is important. So the diagram that you see, ladies and gentlemen, this is a holistic or an overview of different metabolic pathways known to human science. It doesn't mean it is completely everything that actually happens in the body. Hundreds of different pathways connected with each other in all different permutations and combinations. And some smart ass doctor, sorry to use the word, but I think some appropriate words needs to be used. A doctor thinks that he could go ahead and manipulate a pathway to block a certain enzyme or put a certain enzyme or peptide or this, then the other to provide a symptomatic relief on one side, and it does not have any other repercussion on the whole thing. You gotta be kidding me. We need, just looking at the diagram should elicit awe and reverence for the inbuilt infinite intelligence of the body. And these metabolic pathways self-regulate themselves based on different planes that influence the human body, right? And somebody invented a certain chemical that can be dumped in isolation to manipulate, certain pathway or an enzyme to block an pathway or regulate a certain metabolic pathway. Please, that has to stop. That is a wrong way of looking at things. Even though you do not see the problem festers inside and will come back. It will come back some later time with a new label, with a new diagnosis. But that new label, that new diagnosis is not a new problem. It was a repercussion, a consequence of the original problem for which we took reductionist medicine. This is the point. So the point, so let's go back to the tug of war. So what is happening here? What was happening with Mary? The mind can endanger the body. And when the body still have resilience, when the body is still strong, the genetics are strong, the vitality still remains in the body mutes the mind in the case of Alzheimer's, short-circuiting the memory because it prolongs the survival. It's not a failure. Body does it for you so that you can live for the longest period of time. Every single disease needs to be interpreted as a maneuver of the body, that the body is not stupid. Calling body stupid is an effrontery towards infinite intelligence. Please, let's get that point clear. It's a offense against infinite intelligence. It's offense against providence. And this whole concept of biohack, it's a bad word. It's an obscene word. The traditional medical doctors, I saw them use this label, that biohack. You cannot hack biology except you hack yourself to death. All right. This is what is called holistic healing. Consistent across the board. And when you are faced with a problem and your principles say, don't treat it, don't take that patient, because you're going to cause their early demise. This is something that should be very clear to us. This is called principled medical philosophy. You see, all of those stuff that I have mentioned earlier to you, I am explaining to you practically step by step. So the mind opened the door and say, come, destroy me, because I'm going to, I can't remember things. I don't want to remember things. So this is something that we need to understand. the treatment realities, that can we treat these patients? Extremely difficult. Alzheimer patient, it's a huge burden to take those people as patients. And when should we treat those kind of patients? When we should treat those patients when we are sure that when their memory comes back, they have the capacity, intellectual, emotional, and mental capacity still to be able to reframe their past events and look at them with a different lens and come to terms with their stories and expand their intellectual horizons to assimilate. And if not, what happens is we're going to create more damage by bringing their memories, because their memories are going to become the cause of their early demise. Anyway, something much more, another thing which is profound that I wanted to mention about the teleology of the disease. The teleology of the disease, teleology is a word used in metaphysics and philosophy. Teleology basically is a word for teleos, which is the purpose. And again, the point that I was trying to make, that disease has a purpose. Disease is not without purpose. It is a maneuver of the body, is adaptation of the body. Adapting, why? Because it was put between a rock and a hard place. And the body was not given more than two choices, and both are evil. And the body is always choosing the least of two evil for its own survival. And once some smart doctor thinks the body is making a mistake, that's not holistic. All right. So what happens? The teleos of the disease, there are layered teleos, the layered teleologies of the disease. In the case of Caroline, as I mentioned to you earlier, if you remember, Caroline had a heartbreak because her husband, who she still loved, for some reason fell for some other lady, and her world came tumbling down at her feet, and she wanted to forget. She wanted to block her memories. And one thing that I mentioned because about her is that she had a very religious, conscientious son who was taking care of her for many years. And I would like to share with you my conversation with him. And that shows like how deep holistic medicine can go in understanding the disease, which we always thought was always evil. The first thing is the superficial layered teleology is that the body wanted Caroline to live longer. So it shut her mind down because the mind would have killed her like it killed Mary. Right? This is something, the teleology of the disease, meaning the purpose of the disease, a beneficial purpose of the disease. Seems contradiction in terms in the modern times. Disease, beneficial? You kidding me? Yeah, come to terms with that. Okay. Higher purpose of bodily survival for the patient. Now, if we need to expand our lens here, I will come to this, but let's come to terms with it. If Caroline had a soul, as it understood for people who believe they have a soul, her bodily survival had a higher teleos of keeping her alive, going through her suffering unconsciously, was preparing her to purify her soul through the suffering of this world so that she has a better time in the purgatory, in the Christian terms, in the next world, in the next higher dimension, or whatever you want to call it. Well, this is a religious twist to it, but for those who are amenable for this, for some of the people, I can explain to you in another terms, but you can ignore it if you don't believe in God. All right. The teleos of a higher purpose, that the higher being or keeping her alive, was through her suffering, her soul was purifying without her body knowing it, without her physical mind knowing it. So this is what I call layered teleology. And this is something very profound, the last part. Her son, who was a very conscientious person, he told me something very profound. He said, my mother, I don't know what's going to happen with her, but her disease has come to heal me, because when I served her, I felt elevated spiritually, because my service to her had become a means of expansion of my consciousness, my getting closer to the reality. And I saw my mother's disease and my service to her as a part of my own healing. This is, ladies and gentlemen, are the beneficial effects of disease, a holistic way of looking at disease. Anyways, so just so that it seems completely unbelievable for people to understand that such a thing can be done by a body, and body contains that kind of an intelligence at all different layers and levels to be able to, think about the well-being of the people and creating disease in their body so that they can live for the longer period of time. If you think it is far-fetched, we need to understand things through this law, and it's very, very important law that we need to understand. This is that the law of analogical correspondence. When something happens in one dimension, we would always derive those conclusions that similar thing happens on another dimension. This is what is called the law, the great law of analogical correspondence. In simple terms, in Chinese medicine, you might have heard about what is above, so is below. This is exactly the same thing. This is one of the greatest laws in the science of cosmology. Not the cosmology as we understand it, but the cosmology, the ancient cosmology, which is a branch of metaphysics. This is what they talk about, is that what is above, so is below. This is patterns repeating itself on different dimensions. Anyways, look at the memory, cellular memory. Look at immune system, the way that operates. Infinite intelligence. Whenever antigens go inside the body, a virus, and all of the immunology works on it. The antigen, presenting bodies will go ahead and present it to the T cells. The T cells would go ahead and this information is relayed to the T cells and B cells, and which begins to have the highly coordinated process producing targeted responses and cytotoxic attacks and helper T signaling, and ultimately the B cells producing memory cells. Why? Why? Because tomorrow, when the same antigen is found in the body, then the body do not have to go through the whole process of presenting antigen and relaying that signal to the T cell, through T cell to the B cell, and the production and all that stuff can be bypassed to keep the body and overcome that infection in exponentially smaller duration of time. Am I making this up? We just have to close our eyes, think about it. Infinite intelligence built in the body for all different things. And the reason why I mention this, because this is something that is a accepted fact in the science of immunology. It's most well-established principles, and based on which people create vaccines, based on which people know immunology and all that stuff. So the point is, body is infinitely intelligent. So never approach, all the physicians never approach the body as it's something making a mistake, that disease is evil. And we need to go ahead and understand. And we go to the next point, is about role of the physical causes. So am I Luddite? I'm not going to believe in physical things. I don't understand immunology. I don't understand metabolic pathways. Far from that. But we need to have a lens. I'm not against science. Science is sacred. We need to revere science. We need to prize our discoveries. We need to understand those metabolic pathways and all that stuff. But it should only increase us in our awe and reverence, and not try to hack it. That's the point. And also the external things which we see, this is what I called victimhood versus empowerment medicine. We need to first start from inside of the patient, of how he brought his disease, how he created it inside. Yeah, extracellular amyloid beta plaques, intercellular neurofibrillary tangles made of tau protein, neural loss, brain atrophy. Agree with it. But those are secondary. And we need to make sure why these things are coming to begin with. And many a times the amyloid plaque, if I understand it and I do it, amyloid plaque is the body's mechanism to protect the brain from the damaging toxins coming in to assault the tissue. So amyloid plaque is actually a creation of the body. And most of the people who have done the postmortem and looked into those amyloid plaques had a huge variegated number of microbes in them. So the amyloid plaque was not a problem, but was trying to protect the brain from many of those microbes that would assault. And they found the traces, a lot of built up of other toxins and heavy metals in it. So anyways, this is something I think we just, it's a long topic. As I mentioned to you, it's not a trivial thing. It's a completely new paradigm. And this is the future of medicine. If we continue, we have come to a dead end. And anybody thinks they have not come to a dead end in the way they're treating chronic diseases, they need to just get out of their outside into the real world and come out of the rock, that they're living under the rock. And we need to understand that unless and until we look into the deeper root causes, we're going to keep people going in and out through the rotating door. And I wished I had more time, but I'm not sure how we're doing with it. I think I've made a point. I think it's enough. The rest of them, rest of the points are important, but I think I have made my point. So I would like to go to the last slide to skip a lot of the stuff. Last slide, as in, yeah. So again, the punchline. The punchline is that without the holistic understanding, healing becomes mechanical and the problem becomes chronic. Please let that sink in. I'm not telling you as a theory. I do it every single day in my practice. And I've seen that again and again with hundreds of people. What we call chronic disease is not an objective category of nature. It does not exist in nature. The reason why the doctors label disease as chronic is because they want to feel good. Because it looked like an objective category in nature. It looks like, oh, this is an objective reality. That's not the case. The disease becomes chronic because when the disease or its precursor first manifested, the doctor had no clue how to treat it. And he kept putting masks after masks after masks, and he manufactured chronic disease. So chronic disease is a manufactured artifact of the modern reductionist way of looking at disease, looking at human being, and not looking through a holistic viewpoint. And this is why we need to go back, not wade our path in the future without principles of the ancients. So it doesn't mean the way Ayurveda or Unani medicine or Chinese medicine is being practiced right now. It needs revival. And I do believe that the science and discoveries are important, but they need to be interpreted, and their underpinnings should still be the higher principles. And this is what my life goal is, and this is what I'm trying to promote. And I call that methodology the TIB methodology. And I'm working on codifying and laying out principles, representing ancient wisdom of medicine as how it was envisaged, not how it's practiced as of now. I will leave you with that.
Well, Shabazz, thank you very much for that presentation. That is certainly a different twist on things. And I think maybe not only in our field of medicine, but in other aspects, archaeology and everything, we've lost some ancient wisdom, and we make sort of different explanations for things that defy explanation, you know. So anyway, thank you very much for this presentation. For those I will have this up on Rumble as a recording.
Sure.
And I don't think, since we kind of ran over a bit, I don't think there's time for Q&A, but we may have Dr. Shabaz back again for another session or in our Elevated Medicine podcast. I'm going to have Stephanie talk to him about that, and maybe we can do more of a Q&A on the podcast.
Sure.
But
As you can see, it's a completely new way of looking things, and I'm working on writing a book in trying to explain the new diseases through the ancient lens, and this is an endure. It's not about treating diseases. It's about a new stream of medicine, like functional medicine, and I hope I would be able to go ahead and introduce to the world a new framework of medicine, which explains all the diseases under a single framework and brings about the glamour and the glory of the ancient time and reclaim back the respect that those sciences would truly deserve. And the last point that I want to mention, that most of the traditional medical doctors call themselves alternative, is self-humiliating. A 5,000 years old tradition with its extremely profound metaphysical, cosmological, ontological, teleological underpinnings calls themselves alternative to a small infant kid, 80 years old, who have usurped the title of mainstream. You got to be kidding me. All right. I will leave it to you. Beautiful talking to you, Mr. Yusuf, and we'll keep in touch.
Likewise, and we'll stay in touch.